Hello there, welcome to the whole fresh month of August, and when we're going to talk about various sexual and reproductive dysfunction after the age of aging in men. What is more appropriate to talk about is what happens to fertility as men get older. So how old is getting older? In fact, by definition, after the age of 40, actually there are some aging process happening in men. And this is probably because of the hormonal changes that actually reduce the active form of testosterone. And what impact will that have on spermatogenesis? In fact, it will lower the sperm quality as far as the motility is concerned, the number is concerned, and also, of course, sexual desire and erectile function as men get older. But that doesn't stop men from fathering a child. We all know famous people who actually father a child at advancing age. Most people talk about Mick Jagger. Actually, Mick Jagger is relatively young as compared to the others because he fathered a child at the age of 73, just like Charlie Chaplin. Other people father a child, probably top of the group is somebody like Al Pacino. Al Pacino and Robert De Niro all fathered children at the age of 83 and 79. And others also follow suit, actually father a child. Is there any risk in that? In fact, the risk has been documented to show various forms of condition that may affect the next generation. Interestingly enough, people who has got elderly father who actually had in the next generation will have a lower sperm count. So we'll have some degree of fertility issue. But that's not the main issue here. The main issue here is actually children of the advancing father actually may have problems with autism and spectrum, and also may have problems with schizophrenia and also ADHD, which is attention deficit disorders. However, the vast majority of these children are actually healthy because quite a significant prognostic factor of this fertility actually depends on the mother and the maternal age as well. So in summary, as men get older, of course their fertility will deteriorate, but the fertility doesn't really need to deteriorate so much in order to make a man infertile, because we only need one healthy sperm. And although that healthy sperm may be healthy to create a baby, but sometimes DNA fragmentation itself may actually result in the offspring having some issues with schizophrenia and also ADHD and autism, and sometimes fertility problem. For the following week, we're going to talk about what age does to the enlarged prostate. We're not talking about cancer here, we're just talking about when the prostate gets enlarged, what happened to men who has got aging process. Stay tuned for next week's Putting Dr. G on the Spot.